My name is Richard Vines and I'm a co-founder and director of the charity Rare Cancers Australia. I established Rare Cancers Australia with my wife Kate at the suggestion of her oncologist. Kate is a long-term survivor of a very rare thyroid cancer, and her oncologist felt that there was no coherent voice for patient advocacy and patient support in Australia at the time. We are launching the Just a Little More Time report to kickstart discussion about how we as a community might improve the lives and outcomes of Australians with rare and less common cancers. What Rare Cancers has done is bring together data from a variety of sources in a way that's never been done before. We took data from the Australian Institute of Health and Welfare, the Pharmaceutical Benefits Scheme, the pharmaceutical industry and Cancer Australia, and looked at the state of rare and less common cancers in Australia as a whole. The report shows that every year 42,000 Australians are diagnosed with a rare or less common cancer, and 22,000 will lose their battle. This means that whilst rare and less common cancers account for 30% of all diagnoses of cancer, they represent almost 50% of cancer deaths. We estimate that without action, Australia could be confronting by 2020 30,000 deaths from rare and less common cancers every year. A major obstacle to effective treatment is the lack of PBS funding for treatments of rare and less common cancers. PBS funding is typically dependent upon proving that a medicine is cost effective, and that is typically done by conducting a large trial across a large population group. That is very difficult to do when there are perhaps only 10 patients in the country with that cancer. Rare and less common cancer patients face a disproportionately lower level of patient support and treatment than patients with common cancers or other common diseases. Rare and less common cancers are painful and aggressive diseases, and we owe it to our fellow Australians to ensure that we give them dignity and support, and at the very least, a little more time. We understand that rare and less common cancers are a major health challenge. What we expect from the government is leadership. Leadership to bring together the major stakeholders, for example, oncologists, the pharmaceutical industry, public service and patient advocacy groups, to work together to find a solution to this problem.